You finished your 3 minutes of analysis. You know the conflict. But the moment you start speaking, your status drops. You sound like a student asking for a grade rather than a specialist managing a patient. In OET Medicine Speaking, your linguistic status is just as important as your medical knowledge. Today we're covering Phase 2 of the ASE Framework, Script. How to build a roadmap that makes you sound like a senior consultant from the very first sentence. Most candidates make the mistake of using softening language incorrectly. They say, "I would like to just quickly discuss your results if that's okay." It's overly polite and technically passive. A senior consultant doesn't ask for permission to do their job, they lead the consultation. They use directives wrapped in empathy. We call these scripting anchors. In Phase 2, we identify 3 specific anchors during your prep time. These aren't just words, they are shifts in authority. First, the agenda anchor. Instead of asking, "What would you like to talk about today?" a senior consultant takes the lead. You say, "Our priority today is to address these blood test results, and then we will look at adjusting your medication." You've instantly turned a chat into a structured consultation. Second, the clinical lead. Stop saying, "I think you should try to exercise." It sounds like a suggestion from a friend. Instead, use, "Based on these findings, the clinical recommendation is a supervised exercise program." You are no longer giving an opinion, you are delivering medical expertise. Finally, the transition anchor. Instead of a week next, use a pivot. Say, "Now that we've covered the diagnosis, let's pivot to the management plan." This tells the interlocutor you are organized, efficient, and in total control of the time. In those final 30 seconds of your preparation, stop writing. Look at your notes and decide your opening move. Are you entering the room as a comforter, a negotiator, or an educator? A senior consultant knows their identity before the role play even begins. If you can't hear the difference between a student script and a consultant script, you're likely leaking marks in the clinically related communication criteria. Take our 60-second Gap Audit in the description to find your baseline. In the next video, we move to Phase 3, Execute. Stop the trap, lead the room.